Have you ever noticed unusual changes in your body, perhaps a burning sensation accompanied by discharge, and wondered what it might mean? It is natural to feel concerned when something feels out of the ordinary, especially when it involves your intimate health. Many people experience these symptoms and immediately think of sexually transmitted infections. To directly answer the question, yes, burning discharge can definitely be a sign of a sexually transmitted disease. However, it is important to understand that it is not the only cause, and many other factors can lead to similar symptoms. It is a signal from your body that something needs attention, and professional medical advice is always the best next step for an accurate diagnosis. The burning sensation, combined with unusual discharge, often points to an infection or inflammation in the genital area. Several common sexually transmitted diseases, such as gonorrhea, chlamydia, and trichomoniasis, are well known to cause these very symptoms. These infections can inflame the urethra, vagina, or cervix, leading to discomfort and an abnormal fluid releases. But importantly, other conditions not spread through sexual contact can also mimic these signs. For instance, bacterial vaginosis, a common imbalance of vaginal bacteria, frequently causes a fishy-smelling discharge and burning. Yeast infections, also very common, can lead to itching, burning, and a thick white discharge. Even a urinary tract infection, which affects the bladder or urethra, can sometimes present with a burning sensation during urination and might be confused with genital discharge. Skin irritation from soaps, detergents, or even tight clothing can also cause localized burning and an increase in natural secretions. Because the symptoms overlap so much, self-diagnosis is simply not reliable. If you are experiencing burning discharge, the most effective thing you can do is schedule an appointment with a healthcare provider. They will typically ask about your symptoms and sexual history, then perform a physical examination, and often collect samples of the discharge or urine for testing. These tests can accurately identify the specific cause of your symptoms, whether it is an STD or something else entirely. An important insight is that even if your symptoms are mild, untreated sexually transmitted diseases can lead to serious long-term health problems like infertility or chronic pain, and they can also be passed on to others. Furthermore, some sexually transmitted diseases do not always present with obvious symptoms, making regular testing, especially after unprotected sex or with new partners, a cornerstone of maintaining good sexual health. This proactive approach helps to catch and treat infections early. Ultimately, recognizing burning discharge as a potential indicator of a health concern, whether it is a sexually transmitted disease or another condition, empowers you to take action. Seeking timely medical evaluation ensures you receive an accurate diagnosis and appropriate treatment, which is essential for alleviating discomfort, preventing complications, and protecting both your own well-being and the health of your partners. Trust your body's signals and prioritize your health by consulting with a professional.